All right, I would like to thank everyone for attending this webinar today. My name is Emma Tomlinson. I'm the Health Coverage Guide at San Juan Basin Public Health. The first thing I would like to mention is just some information about the webinar. Of course, for privacy, we just want you to know your name will not appear, you will be muted, and you will not be able to show any video during the webinar. And the reason for that is primarily for privacy. So we do have Spanish translation available. These are the instructions on how to access the Spanish translation. So all you need to do is click the interpretation button at the bottom of the screen, and then you want to go ahead and select language and then mute original audio. We will be using the chat function to ask any questions or answer any questions throughout the presentation. So feel free to put anything in the chat as we go along, or we will address questions at the end of the presentation as well. You can access the English and Spanish versions of the slide in the chat. If you don't see them already, we can also send them to you directly. So again, my name is Emma Tomlinson. I am a health coverage guide at San Juan Basin Public Health. The presentation today is specific to Connect for Health Colorado and Colorado Connect's open enrollment with a focus on the OmniSalud program. First, I want to chat with you about our team and what we do in the health insurance literacy program. So there I am, Emma Tomlinson. We also have Karen Meletich, who is our health coverage guide, and of course, our leadership of Tiffany and Kalisha. So in the health insurance literacy program, we offer a free service to finding affordable health insurance and understanding the health insurance coverage. We currently serve Archuleta, La Plata, and San Juan counties. So the three primary programs we currently work with is Connect for Health Colorado, the new Colorado Connect, and Health First Colorado, otherwise known as Colorado Medicaid. Here are the eligibility requirements for each program. So for Connect for Health Colorado, where you can receive tax credits to lower your monthly costs. Of course, you have to be a resident of Colorado, file taxes. If you're married, you must file jointly, citizen or legally present, and you cannot be eligible for Medicare or Medicaid. On Colorado Connect, you just have to be a resident of Colorado, and you cannot be eligible for Medicare or Medicaid. For Health First Colorado, otherwise known as Colorado's Medicaid program, you must be a resident of Colorado, citizen or legally present, under the age of 65, and meet income limits. There are special times in which you can apply on Connect for Health Colorado and Colorado Connect, which happen to be the same, is during open enrollment, which is coming up soon. It's November 1st through January 15th, or during a special enrollment period, otherwise known as a life-changing event. That can be marriage or a birth or even an adoption. For Health First Colorado, there are no enrollment periods. You can apply anytime. So again, I wanted to talk about Connect for Health Colorado and Colorado Connect open enrollment. Just a reminder, as always, the open enrollment period is November 1st, so it's coming up next week through January 15th of every year. What's new in 2023 is for at least Colorado Medicaid, the public health emergency is expected to end. So what that means is they want you to update your contact information as soon as possible so that if there are any changes to your case, they want to make sure they're reaching the right place. And then for Connect for Health Colorado in 2023, there's a solution to the family glitch, which means that if your employer coverage offers unaffordable insurance to your family can now apply for tax credits on Connect for Health Colorado. On Connect for Health Colorado and Colorado Connect, Bright Health plans will no longer be offering plans. This will affect a significant amount of people in our area, so you want to make sure to review your options during open enrollment. And of course, the most exciting part is undocumented opportunities on Colorado Connect through the OmniSalud program, which we're going to get into more detail. So what is Colorado Connect? So Colorado Connect is a for-profit entity that benefits the public. It includes a shopping platform, so similar to the Connect for Health Colorado marketplace. It's where you can go ahead and shop for health insurance. So this is eligible to Colorado residents, so anyone that lives in Colorado, regardless of immigration status. So this gets into a little bit more detail about who can shop on Colorado Connect. So as I said previously, it's for any Coloradan who is undocumented, any Coloradan that is impacted by silver loading. I know that's confusing. What that means is if you are not eligible for tax credits on Connect for Health Colorado, you can go ahead and shop for health insurance on Colorado Connect. So specifically, I want to get into a little bit more detail about the OmniSalud program. So through this program, like I said before, individuals and families can compare and shop for plans on Colorado Connect when they couldn't do so before. And then dependent on your income, some individuals and families might be eligible for a zero costing health insurance. What that means is you don't have to pay for health insurance per month. You still have to face things such as deductibles or out-of-pocket maximums, but the monthly cost to pay for health insurance won't be there. And Katie, I'm sure, I don't know if there's a lot of questions, but if you can check the chat for me, I do want to pause for a moment just to see if there are any questions.
So I have not seen any questions come through yet, but I do have one question myself.
Please. Yes.
So you mentioned that this program is open to Colorado residents regardless of immigration status.
Yes.
How will Colorado residency be confirmed?
So it's trusting the person who applied for it. Quite honestly, if you are not a Colorado resident, say you live in what's the closest to us, New Mexico, and you apply or purchase health insurance here, what's going to happen is you're going to find yourself going to the doctor in New Mexico and your insurance coverage won't pay for that visit. And that's because these plans are specific to Colorado. So a lot of what you're going to be reporting is just from word of mouth. They're not going to be requiring any verification of citizenship. The only information that they're going to really need is information regarding, well, of course, your name and also your income, so they can see what you might be eligible for. Did that answer your question, Katie?
Yes, thank you very much.
So this is most important. I want everyone to know that whoever does purchase health insurance off of Colorado Connect, that you are protected. You are legally protected. That means that Colorado Connect won't ask for your immigration status. The information that you provide is with Colorado Connect only, and they do not give it to any entity outside of Colorado Connect. And that includes any federal partners, and it cannot be used for immigration enforcement. So just know that when you do give your name, whenever it goes into Colorado Connect, your name is going to be in Colorado Connect and will be on your insurance card, and that is it. What's most important is you want to make sure to use the same name for Colorado Connect as the same name you would go to your doctor with. So for example, let's say I had two middle names. I only have one, but let's say I had two middle names. It was Emma, Rose, Jessica, Tomlinson, but at the doctor, they know me as Emily or Emma Rose Tomlinson. Then I would report it to my insurance at Colorado Connect as Emma Rose Tomlinson. So just make sure that whatever your doctor has your records under, make sure that that matches up. Any questions regarding this?
I am not seeing any questions coming through at this time. Again, we can, just to encourage folks, you can use the chat to ask questions at any time.
Thank you. So I want to reiterate, this is a new program that's come out, Colorado Connect and the OmniSalud Program. So it can be really confusing. I know it's really intimidating to go online and give information. Again, they're not going to be asking for a significant amount of information, but if it does get confusing or if you have more questions, we are here to help in the health insurance literacy program at San Juan Basin Public Health. So just know that when you do talk with me or our other health coverage guide, Karen, that you are in a private space and that your privacy is protected through us because we are certified through Connect for Health Colorado and Colorado Connect. Here is our contact information so that you can go ahead and reach out. If you want to set up an appointment, feel free to call or email us and we can get you set up for an appointment during open enrollment. We are currently offering in-person and virtual visits, and we will have translation available as well. So I'm going to open it up to questions, and I'm going to leave our contact information up while we're going through any questions.
Thank you, Emma. So a few questions have come through.
Yes.
What will be needed for proof of income?
So they're not going to request, unless your income is questionable, they are not going to require any verification of income. So no check stubs, nothing like that. You just want to be honest with what you're reporting.
And is that the case for all programs?
Only on Colorado Connect through the OmniSalud Program. So on Colorado Connect, or excuse me, their names are so similar. On Connect for Health Colorado, you will eventually need to provide verification of income, and for Medicaid, they do require verification of income at this time.
And would that be something like a pay stub?
Pay stub. Yep. Something similar as a pay stub, or let's say you babysit for a family and they give you cash, you would just do, well, for that it'd be self-income, so you would do a profit and loss statement. So there's different versions of income verification, but we're here to help you through that.
Great, thank you so much. We have another question. Are all options from the marketplace only applicable in Colorado? Can any insurance be used in the Four Corner states?
So the plans that are going to be available are only available in Colorado. That being said, if an emergency happens, so for example, I go down into New Mexico all the time, and let's say I go down there and I'm hiking and I break my leg, I'm not going to drive all the way back to Colorado to go to the emergency room. I'm realistically going to go to an emergency room in New Mexico. The emergency room visit is covered with any of these plans, but it's the follow-up visit that's not going to be covered. So the only thing that will be covered in another state, and it's all states, is emergency care.
Thank you for that.
Mm-hmm.
If we have any other questions, feel free to drop them into the chat. While we're waiting, Emma, I'll ask, can you just reiterate again how confidentiality will be protected for those going through the OmniSalud process?
Sure. So again, and I'm going to go back to that slide, if that's okay. So Colorado Connect went through a lot of policy and spoke with a lot of lawyers, and through this specific program, through the OmniSalud program, they want you to know that you are legally protected and your information is legally protected. That means that ICE will not be showing up at your door. This doesn't count against anything. So for example, if you are trying to apply for citizenship or legal permanent residency, this isn't going to affect anything. This is just you purchasing health insurance off of a place that will offer you health insurance. For the subsidy program, so the OmniSalud program, so if you are at a certain income level where you don't make too much and you can get a $0 monthly premium, then I mean, they're not going to ask for any more information. You're still protected. So it doesn't matter which hoops people are trying to jump through. You're always going to be protected no matter what.
Great, thank you for that. And if someone does schedule a one-on-one appointment, what can that time be used to cover?
So in a one-on-one appointment, we can go ahead and talk with you about your options. So since we are a sisters and assistant site, that means we're not going to force you into a health insurance plan, but we will help you when you make that choice. So that means we will help you with enrollment, and we will also help you find a doctor that can take your plan. And then we can also tell you what services are also free according to your plan. Or we can just talk about health insurance. You don't have to do an enrollment whatsoever. We're just here to answer any questions.
Great, thank you. All right, do we have any more questions before we wrap it up? Okay, so I will just mention that we do have several enrollment events coming up in the course of the next couple months. We will be sharing that information broadly in the coming weeks, so keep an eye out for that. Thank you to everybody who joined us today.
Thank you, Katie.
All right.
And thank you, Danny, as well.
Yes, thank you to our wonderful interpreter, Danny. All right. I hope everybody has a great evening.